This is Chapter 16, Health Problems of School-Age Children and of Adolescents. So we're going to start out with problems of elimination, the first one being enuresis. So this is bedwetting past the age where most children are potty trained at night. It's more common in boys, and most of them this resolves by 6 to 8 years of age. Some of the things parents say is that they feel like their child's a really sound sleeper, that they don't wake up with the sense of needing to void because they sleep more soundly than others. We do know there's also a family tendency, so if the parents had issues with enuresis, the children are more likely to. Some of the ways to try and treat this are to restrict fluids, so nothing to drink past dinner time, and no sugary drinks or caffeinated drinks after 4 in the afternoon. Some parents will interrupt the child, wake them up during the night, and make them get up and void. There's also alarms and things you can buy, and these alarm at the first, as soon as the child starts to void. Any moisture hits the alarm, the bed alarm, it wakes the child up. And so the hope is that it conditions them, that they get this sense of feeling like they're about to void, wakes them up. And all of these will work for some kids, but they seem to work better kind of in combination. Some kids, none of these help, and we have to go to medications. The DDAVP decreases the amount of urine you make during the night. The others make your bladder just less likely to have spasm or to void. Another problem with elimination is encapresis. So this is stooling. It's defined as repeated voluntary or involuntary passage of normal feces, so it's not having diarrhea, into inappropriate places. So it can't be caused by a medical problem or the child's on a laxative. This is they're having stooling, not in a toilet. So again, it's potty trained children. Again, more common in boys, and this does often go with psychological stress, that a stressful event happens, or just fear of using a bathroom at school, something like that, some sort of psychological stress. Often it happens with constipation. It's kind of a secondary problem that happens with constipation. And it's the child may be constipated, and so it hurts when they stool, so they hold the stool, which allows it to get harder and larger and make it very painful when they stool, and so that reinforces this withholding of stool. Or we have the child who's afraid of using the bathroom at school, so they hold their stool. Again, it gets hard and large and is painful when they go, and now it kind of reinforces this fear of stooling, and then it stretches out the colon to the point that they don't really have good control of controlling their stooling. So it comes suddenly when they don't realize it, because they have lost the ability to really control it well. So it's this vicious cycle. So we do want to figure out what's going on first and work on that. Our goal is to get these kids to have a normal bowel pattern. Most kids have 1 or 2 semi-soft form stools a day, and that's what we want to get to. Sometimes we can do it just with dietary interventions, more fluids, fruits, and vegetables. Sometimes we're going to need to add medications, stool softeners, because we want to avoid that constipation, which is causing the pain, which is causing the withholding, which is causing further constipation. And then we want to figure out what the psychological stressors are that are causing this and intervene with those. Okay, so moving on to ADHD. This is another issue we see in kids, particularly in school-age kids. And this is characterized by 3 components: inattention, impulsivity, and hyperactivity. This inattention may be better described as distractibility. It's not that the kids don't pay attention, it's that they pay attention to everything. They're supposed to be doing a math paper, but they're listening to the fan, the air conditioner fan blow. They're looking at the kid next to them who has blue shoes. They notice that the teacher has a whole stack of papers on the book, and oh, the girl over on that side is wiggling like she has to go to the bathroom, and oh, look at that. They're seeing everything that's going on rather than just attending to the one thing they're supposed to be attending to. Impulsivity. If you ask them why they did something, they honestly will say, I don't know. They do it before they think about it. And this impulsivity can have a lot of social problems. They go running out at recess and push all the kids out of the way and run out the door first just because they're anxious to get to recess, and they're impulsive. They can't stand and wait their place in line. And again, that can cause some social problems in school. Hyperactivity, this one, well, all of them can be in varying degrees, but hyperactivity, we see a lot of variation to this, and particularly in girls, they often don't have the hyperactivity, and so teachers may not realize how much trouble they're having, because the hyperactivity is what really stands out. The kid who can't sit still, they're wiggling and tapping and moving. So you put all those three together. It has to happen in at least 2 different settings, usually home and school. So it can't just be in one place, and it has to interfere with their normal functioning. They can't complete their homework at home, or can't do their schoolwork at school. So treatment is best when it's multimodal, when we do more than one thing. Behavioral therapy, making a behavioral plan with these kids is really helpful. So having consistency, they know exactly what's going to happen, and there's a plan that says you will do this. If you don't, this will happen. If you do, this will happen. So they know the consequences, both the rewards and the negative consequences of following that plan, and consistency in implementing that plan. Medications. The medications we use are stimulants, which stimulate the brain to improve their focus, to improve their attention, to let them ignore all the distractions and focus on the one thing they're trying to do, whether that's, reading or math or whatever. Most of our ADHD medications, well, in a lot of ways, they're very similar to caffeine, just chemically, they're very similar to caffeine. And there are some of us who say, I can't function without my coffee in the morning. So anyway, the side effects of most of these medications are decreased appetite and difficulty with sleeping. And again, that's similar to caffeine, right? If you drink too much coffee, for most of us, it will upset our stomach, and it interferes with sleep. So the long-acting ones are nice because they don't have to take it again during the day, but that may be a problem with eating dinner and getting to sleep. We usually want these kids to eat breakfast before they take their medicine, so that they do eat. And then family education and counseling, so they learn how to do a behavioral plan, how to follow through with it, how to be consistent, and then manipulating the environment. These kids are so distractible. We want to minimize the distractions as much as possible, both in the classroom and at home. They need a place where they can do homework, where they're not going to have all the distractions going on around them. Okay, a big problem with teens is acne, and this happens because these sebaceous glands become very active, and they have secretions, and then increased oil increased size of the glands with increased oil, and then those glands get plugged up with oil and debris, dead skin, dust, dirt, and then infect. So our peak age for girls is 16 to 17, peak age for boys 17 to 18. Some of the things that contribute to problems with acne is family tendency. Some families are just more prone to it than others. Hormones. Girls say that there's a real flare-up of acne right before their period starts. So premenstrually, those hormonal changes will cause acne. Stress, cosmetics, and then girls use more makeup to cover up the acne, which then plugs up the skin or plugs up the glands and makes more acne. Foods do contribute to it, but studies say it's mostly dairy foods and high sugar foods. I know many people claim oils and chocolate and things, but studies are not as conclusive on that. So the main treatments, general health, anything that improves your overall health will decrease acne. So getting enough rest, enough exercise, eating a balanced diet, decreasing stress, those are all good things. Cleansing the skin. Over-cleansing is not good. What we want to do is once or twice a day wash the face with a mild cleanser. That's all that's needed. Hair care for some kids really does contribute to it. So regular shampooing, and if they're having a lot of acne on the forehead and temples, getting a hairstyle where the hair is pulled away from the face will help. There are medications out there to help, many of them over the counter. You've probably heard of Retin-A. It's a cream that can be used that is quite effective, but it makes the skin more prone to sunburn, so that we need to tell kids to use sunscreen. Creams and gels, cleansers with benzoyl peroxide are very effective. But they will bleach clothing and sheets. They don't bleach the skin, but we should warn kids that, their favorite clothes could get bleached. Sometimes topical antibiotics will be given. This requires a prescription now. Topical antibiotics are helpful, but we see the most effective we combine the topical antibiotic and the benzoyl peroxide creams. Putting them together is more effective than either one alone. If that doesn't work, we'll sometimes go to a low-dose oral antibiotic, but like all other antibiotics, you need to watch for GI upset. The ones we use are ones that tend to have the photosensitivity issues, so tell these kids to use sunscreen. And with girls, vaginal yeast infections are always a risk with oral antibiotics. Because of that hormonal component, they're saying that combining oral antibiotics with birth control pills seems to be very effective for some girls. And then if nothing else works, Accutane is a very effective medication for the cystic acne, which is the big red sore ones, not the whiteheads and blackheads, but the big red sore acne. The treatment goes for 20 weeks. The problem with Accutane is it has a lot of side effects. It's very effective, but a lot of side effects. Causes dry skin, headaches, causes mood changes, can cause depression, including suicidal thoughts. So we really need to be watching that. And the other issue with it is it's highly teratogenic. Not just it may cause birth defects. If a girl is using this and gets pregnant, there will be issues with the baby. There will be anomalies. So we really want to make sure girls taking this are also using some sort of birth control. Okay.